In both the cases, you might have noticed that um, a deeper partnership was developed with the community. And our approach to this partnership was not coming from an expert-driven or top-driven approach. It was with a kind of humble um, request to the community that we are interested to know about the lived knowledge on a particular issue. In the first case, we started our conversation with the adolescents about their own health behavior or health-seeking behavior. And in the second case, how community perceives the usage of water, and all the insights were drawn from the community members. So it was more like a discussion and joint exploration to begin with. But in the process, we also invested um, in building capacities and understanding, and in a way sort of break down the jargonistic social research to an understandable, which is understandable by the community. The adolescents mostly were coming with sort of 10, 12 standard, or some of them were already studying in the colleges, so they have the basic education, but they were not familiar with the research methods at all. But in the process, they also and sort of we jointly demystified the concept of doing research with the people. Um, and what do you want to know? That was the sort of starting question, and then they listed the things that they want to know, and then we started a discussion. Then what could be the ways in which we can know these, and then they identified all the stakeholders, who can give this information in what form. So what kind of questions would be most appropriate to get these insights from various stakeholders? What would you ask to your parents? What would you ask to the frontline health worker? What would you ask to the municipality? So in a way, it sort of, it took time, but it really broke down the approach and the design of the research to the granular level, and using those questions as a kind of learning questions for them, and then carry out the interviews, the focus group discussion, and also when we did the participatory survey in the first case, some of the questions were contributed by the adolescents themselves, and the community members themselves. So we had a kind of preliminary questionnaire because we had to follow some ethical guidelines and all those research ethics. But those needed to be in a way sort of adjusted and adapted to respond to the community's learning question. So it's a kind of dialogical process that we had with the community, and also with the municipalities and other local public institutions, that what would they like to know from this research study, so that the findings would help them to improve their work. So in a way, it's a kind of multi-stakeholder uh, sort of collection of learning questions, which then put together in one place. And the research process was more iterative, um, and it was kind of very, very free-flowing things. And we are not sort of captive to a particular research methodology or a research tool. Therefore, you must have noticed that in both the cases we have used multiple methods to explore. Yes, there is a challenge when you sort of collect data from multiple methods, to collate that, triangulate that data, and sometimes conflicting data comes, from different sources. But that was also an opportunity to take it back to the community or with other stakeholders and get further insights that why two kinds of findings are coming Um, and at the end of the day, we also embraced a little bit of subjectivity into the process, because it's, after all, people's experience, and whatever they have seen and perceived based on their existing knowledge, they narrated those experiences with us and with others in the community.
Thanks. This is fascinating. I mean, I think you were very clear it was very clear in what you said about how methodology is in fact not a hurdle if you start from the questions, right? If the questions are co-created, then it's easier to move on to methodology. But you also mentioned a number of things, like the fact that it's a two-way capacity building process where researchers themselves need to demystify their own language and get out of their comfort zone to reach out to people who are not trained in research, very simply. But also the training also in in research, the involvement in design of research tools and in the testing and also the vetting in terms of evidence. So it's the whole kind of research process kind of engagement. I think this is fascinating, and it's a very important message too.
Francisco, if I may add, I just forgot to mention, it's not only the research methods, the participatory survey that we conducted in the first case, the data was collected through mobile-based application. And the community, young people were so excited to learn about, technology is one thing which fascinates particularly the young people. And they were particularly fascinated with the way sort of, the paper-based questionnaire was sort of framed, and then it was converted into a kind of mobile-based application, and they were collecting data. And as soon as they collect the data, they could see that data that they have collected. So this was also a kind of additional training. So in a way, it also ensured that some amount of capacities are reside with the community, even when an external researcher like us leaves the community. So it's not so it's kind of giving back to the community with certain things which they didn't have, but also getting the community's insights which we didn't have. So it's a kind of mutual and sort of reciprocal relationship based on mutual respect. Well, one of the deliberate choices that we made was to partner with the local community-based organizations. And those local community-based organizations have been working on various issues, not only of the adolescents or young people, but also other issues faced by the community. So this particular research process, in a way, acted as a trigger to explore the issue in detail, and also provided an opportunity to interact with other stakeholders, which otherwise was not happening. So the interaction with the municipality, interaction with the health workers, or interaction with other stakeholders, all contributed to the better understanding of the issue and the institutional bottlenecks, as well as the community's bottlenecks to address this issue. And this research was always a solution-oriented research. It's not only exploring the problem, but as we explore the problem, we are sort of jointly exploring with the community and other stakeholders that how to address this issue. And that was the point of energy, or source of energy, that something positive is going to happen. And then this partnership with the community-based organizations, who anyway sort of was continuing the work with the community, they took up this issue. So as a researcher, our contribution was, and a kind of external researcher, our contribution was to trigger that energy into the community and the participants, but also building capacities of the local community-based organizations to continue this issue, addressing this issue with the community. So from our own experience, not only these two research studies, but in all the research studies that we have done, we have always tried to partner with the local community or community-based organizations. And therefore, this has not been a major issue for us, that what will happen once the research is done. Because that question is taken into consideration at the design stage, and part of the design is also to discuss partnership, and which partner can bring in what kind of resources at the time of the research study, but also after the research study. So take a concrete example from the first example. Of course, the university faculty members and were interested to see some kind of academic output from the research study. And there's sort of two kinds of research outputs there. One was on the methodology, and the second was on the research findings itself. So these are sort of two academic output that we were also interested, and the academic institutions were also interested. Then we also, in the process, created a lot of pedagogical material, like audiovisual materials on the research process. These were not only evidence of doing research with the people, but also those are sort of prepared in such a way so that other students would be inspired to undertake similar research processes. Then we had to think about that what would be the sort of research outputs for the community, and then there we had to really break down the language in a kind of everyday language, and demystify all the scientific jargon, and telling them let's say the impact of climate change on water, and drawing a kind of history of a historical trajectory of the water, how the water has depleted. And they recalled that a lake in that location, which was earlier occupying 370 acres of land, it has sort of reduced to the size of 2 acres. They could relate to the changes. And also it triggered in a way sort of community behavior change. And particularly here, the adolescents became again champion. Some of the adolescents, they started sharing that the elders are misusing water. They never close the tap of the water. They keep it running. So they started taking action in the community and started telling their parents and other community members that we have to live here for another 100 years, so don't waste the natural resources. And so this kind of it's not only the written sort of output, but also audiovisual outputs, but also community action as an output from the researchers. So we generally in all our research studies, we try to sort of respond to the different stakeholders' knowledge needs. And therefore, part of the research studies were converted into a kind of easy to understand material, even for the municipal officials or for the frontline health workers, so that they understand that how their action could improve or their inaction can deteriorate the situation. And it is how they are accountable to the needs of the community. So whole lot of engagement through those outputs were sort of facilitated in the process. So it's multiple outputs from the same research. Well, I mean, the partnership with some of the other knowledge institutions, for example, in the second case, we partnered with All India Institute of Medical Science, and they have a a heavy duty focus on the health impact of anything happens in the community. And similarly, the National Institute of Research on Environmental Health, they have a focus on the impact of, or sort of impact on health from the environmental variables. Uh, so both these institutions were also in a way charged up and motivated to undertake their own research studies. But one of the good things that happened, that they started understanding the principles of participatory research. What it is. It is not the method in itself. You can use any conventional research method to make it participatory, or even participatory tools could be as extractive as any a conventional research. The principle here is that if the community becomes the source of knowledge, that knowledge ownership must be with the community, and community must be able to utilize that knowledge to change their own situation. So these principles would guide any methods that you follow in the research process. So even if it is if you go for experimental research, uh, you have to follow these, and then there is a kind of conflict with the experimental model of research, that some of the communities are not really stakeholders in the research process. You are there to extract data from this community. So we have some ideological positioning vis-a-vis some of the experimental methods. Um, but it's possible to involve the community, and if you uh, if you think that the first sort of level of engagement is to build trust and bring out certain sort of insights from the community, which would be the basis for going deeper and having a kind of deep dive into those questions, you can continue that engagement. But at the same time, it's not that the research should not contribute to the positive changes or social action. The process of engaging them in the positive social action itself is an action research. So in all our work, we follow this cycle, that how change happens within the community. And our sort of theory of change is that it is based on the knowledge and learning. It's based on the knowledge and learning. And so our effort is always to create a co-learning, co-creation process with other stakeholders, where communities takes the center stage. Oh, yeah, it is indeed difficult, but uh, I mean, I'm sort of, I place myself as a researcher, but at the same time as a facilitator with the community and other stakeholders. And there is this um, belief uh, among the researchers that research should produce evidence, and if you place this evidence before the policymakers, change would happen. Um, so this simple sequencing does not work. And many times we struggle to find answers that why certain things are not changing despite producing heavy duty evidence. And there comes the politics of knowledge. And it's not only knowledge in itself is not a trigger to change, but you need to, and perhaps there comes the question of learning. And once the stakeholders start learning from the process, perhaps they are much more convinced about the desired change, as opposed to a third party doing research, telling them truth, and they accept that truth, and therefore they take action. So we are sort of, as a facilitator or change facilitator, we are continuously struggling with the different interests of different stakeholders, and the role that knowledge can play in bringing out positive change, which might not happen without garnering the support from other stakeholders. So that's the kind of, perpetual struggle, whether it is at the local level, or it is at the provincial level, or at the national level. And therefore, the collaboration, partnership, um, finding allies with those power holders, those become the complementary factors to bring positive changes, whether it is at the policy level or at the local action level.